Hello and welcome. I'm Nicole Heimgartner, and this is my emotional support person
And colleague.
and colleague, Cherie Rebar. You may have met us before. We've had so many opportunities to present with Odin, and we just have so much fun connecting with the Odin community. And I believe, I don't know, maybe it was Brian that said we could be in a box and have fun.
Have a good time.
Yeah, I think we could.
We could. I think that's one of the best things about this, but we love Odin because this is what I like to call boots on the ground.
Yeah.
This is all of us being able to come together and find solutions, being able to find things that work for educators that are out there every day. And what we like the best is we live this life.
Exactly.
We are you and you are us.
Exactly. And, we have to be real with each other. We have to be real with not only the problems of nursing education, but talk about real solutions to the problems that we face, not the kind of pie in the sky. We all don't operate in systems that have endless money and endless opportunity, but we do have opportunities to make huge impacts, even with simple things that can make a huge difference. And just having that real conversation for the things that are really impacting not only nursing students, but nursing faculty.
And the profession.
And the profession as a whole, I think can be a pathway to changing things moving forward.
I do too. And there's a lot of things that bring us joy too in nursing education that are wonderful, but usually people are coming for the solutions of things. And one of the things that I think is really important that we talk about is what kind of language we use. Because anytime that you and I talk, we always start off with definitions of things. To make sure we're all on that level playing field, everybody knows what operational definition we're coming from. And I think we need to talk about the most is the term resilience. Because that term has been around for a while.
I mean, if you're in clinical practice, that just means I'm going to bring you a pizza and we're going to have a pizza party, right? That's what it means now.
Or a rock. It says you're a rock
That
star.
was the best one. That was the best one. Like, Happy Nurses Week. Here's your
pet rock.
Please be resilient. Come back tomorrow. Nothing says come back tomorrow
Is
like
that
a
true?
rock, like a painted
Did you know?
rock.
Absolutely.
Entire health system
Absolutely.
gave their nurses painted rocks.
And
Please
there
come back
is-
tomorrow.
Another system gave them Band-Aids because you hold us together. You can't make this stuff up.
Can't make it
This
up. This is real.
This is real
This
talk.
is real.
Well, and of course that word has been passed over to, nursing education because we now need to teach students to be resilient, which I think we know what we want. We know
Exactly.
what the end game is. We want them to want to come back tomorrow.
Right.
Genuinely come back tomorrow. But how do you do that when you're working within a system that maybe doesn't even understand the word?
Exactly. And we've talked a lot. Cherie and I have just talked a whole lot about this concept of resilience and professional identity and how that really has to be one of the pillars that we implement with our students.
And ourselves.
And ourselves, just as much as clinical judgment.
Yeah.
We've got, of course, they have to have the ability to think and to make safe clinical judgments. But to practice effectively in today's environment, they have to be equipped to understand what resilience is and how to be resilient.
How to get it. How
What
do you
keeps
achieve
you
resilience?
coming back? Yeah.
Yeah.
What keeps you coming back?
I think that's very important that we ask that question of nurse educators because right now we're losing nurse educators just as much as we're losing nurses proportionally. Because, frankly, the ones that have been here for a while, we're tired. Now, we love what we're doing. We're going to keep doing that. But there are some folks that are getting even more tired than that maybe have been doing this longer, that they're ready to exit. And the worst part is when we've got new folks coming into nursing education that want to teach, that are excited to teach, and then they get handed a bunch of papers and a book with the phrase, good luck.
Yeah.
Good luck.
Here's your rock.
Right, here's your rock. How are you going to build anything out of that, and how are you expected to be resilient? And what does that mean in that capacity?
Right.
So we're going to have some real talk about what we do because it is past time that we shepherd this next generation of nurse educators and that we nourish the experienced nurse educators that are with us.
Absolutely. And a lot of that, I think one of the key things that promotes resilience is combating incivility. I mean, we have incivility within our profession, and
Too much.
we do, and it's in academia. We see it with our students, and if we don't address it with our students, where does it go?
Right into the clinical environment.
Well, and I wondered too, and you know, I've always, you know, nursing is the art and the science. You've got to have both. And I've always been heavy on the science,
Same.
but I wonder if our push, because we've got to have safe nurses.
Yep.
There's no question.
Who are assertive when safety's compromised or
Correct.
could
We've
be.
got to have safe nurses. But have we lost some of that art that comes with compassion and empathy and civility and humanity to not only our patients,
Right.
because, you know, how do we have them, you know, teaching them empathy to patients, and yet they're acting terrible to each other,
Right.
or they carry that into the practice environment.
Yeah.
So I think these are things that I love using role play in classroom. We role play a lot when we present.
We do.
I usually get to be the difficult one. Imagine that.
Because that just comes naturally.
Thanks.
You're welcome.
Anyway,
No extra charge.
no extra charge. So role playing a lot of these scenarios and how to de-escalate situations, and also how to respect and empower
Yeah.
other nurses. No one's in competition, and that's where
Right.
I think that there's this imaginary competition of everything versus this collegial environment and profession. You know, it's almost like the historic, like, doctors versus nurses, you know.
Where there's room for everybody at the table.
Absolutely. You know, a physician needs nurses. Nurses need physicians. It doesn't mean the physician is over the nurse. The nurse has their own scope of practice,
Right.
just the same
And we
way the
work together.
physician does. You know, and really emphasizing that working in that scope of practice and maximizing that scope of practice and empowering each other.
And we need to empower the students to know how to work in that collaborative when they're out there, because we can't expect that we just turn a switch when they get ready to graduate and they know how to do it. And the way we do that is we role model that for them. And we have to reel that back even further and say the way that we role model that for them is we have to know what that looks like.
With faculty.
Exactly. And with
Yes.
leadership
Yes.
of faculty. It is so important because, again, I picture this giant long table. There's room for everybody at it. But what has happened that I think has affected so much resilience within the educational environment is everybody's trying to push somebody else out.
Yeah,
Exactly.
there's no room here for
No,
you.
not you.
There's no room here
Exactly.
for you. And
Exactly.
that's bull.
It
You
is.
know, because there is room at the table. We have a profession that is
It's shrinking.
It's shrinking, and we have greater needs. We've got to have more nurses.
Yep.
We've got to have more nurse educators,
Right.
and it's a good profession. There is so
Yeah.
much joy in nursing education. And
Yeah.
really, that's what we want to get back to, because I think in a lot of ways what promotes resilience is finding the joy
Yes.
in what we do.
Because nobody's coming to work if it's not fun.
No.
Well, okay, let me take that back. People may come to work if it's not fun, but they don't want to stay.
Correct.
And they may not perform to the level that they're able to perform or that they want to perform because they're just trying to get by.
Right.
They're just trying to meet whatever today's quota is or whatever that minimum benchmark is because they've been beat down so much. And you know, that's one thing that is unique, I think, within that educational environment is we don't see each other all the time like somebody in an office might.
Right.
We kind of pass each other, especially in nursing education, because we go to clinical. Some people are in a simulation or laboratory environment. Classes meet at different
Right.
times. So, you know, who meets each other? The times that we're together, it's very limited anyway. And then how much time is there to mentor so that that person can teach well and find joy, which brings resilience in the long run.
Right.
They become more resilient. So if we're acting a fool in the middle of all of that in the limited time we've got, that puts us right back here to why people leave. They leave the
Exactly.
profession of nursing itself, they leave the profession of being a nurse educator. And frankly, it's hard enough because we all know we're not here for the money as a nurse educator. You know, we could all make double going out and be a clinical nurse. We could make triple if we wanted to be a travel nurse. And I mean, I would like to have that money, but that doesn't bring me joy.
No.
This brings me joy.
No.
And we have to give that to the others. That's what I think is important. We've got to have some real talk about how that we foster that for others so they can have the enjoyment that we've enjoyed and that we want to continue to enjoy over time.
Empowering other nurses to reach their maximum potential and empowering other nurse educators to grow. You know, one of the things that I guess is coming through my mind is just thinking about Benner and the novice to expert. So most nurse educators have come into nursing education as an expert clinician
On this side of that
on
continuum.
this far end as an expert, and that's awesome because we have to have that clinical expertise.
We're a practice-based profession.
But they come in as an educator, as a novice, but they want to be still as an expert. And I think it's really important to underscore that you can claim the expert clinician and also claim the novice as an educator and realize that you can grow along that continuum in more than one place. It took me a hot minute to realize that, you know.
You just think you're equipped.
Yeah.
I'm a great nurse.
I'm a great nurse, so I must know how to do this.
But you now have two professions.
Exactly.
When you become an educator.
Exactly.
You have a profession as a nurse and a profession as an educator, and we're trying to marry those.
Right.
And in some capacity, we've got to come alongside those folks coming in, even if they've been a nurse forever, and help them learn how to teach. I think that's been one of my favorite parts of this conference is getting to just talk to people, because a lot of times they'll come up to us after we've talked and say, you just make it so practical. You know, and that's what they need to hear.
Or
they don't
you make it feel safe.
Well, that's
that
even
makes
better.
me want to like cry.
Yeah.
Because
they can
should,
be okay.
They should feel safe.
Yes.
In their practice environment
Which
as a
is
nurse
education.
You know, and so if anything, I think that's a huge underscoring to how we build resilience. Is
Agreed.
creating that culture of safety and empowerment.
Competition, because there's room for both of us and anybody that we meet in this profession. There's room for all of us. She's the first person that will tell me something's off. She's also the first person that will say that was great. And you know, we need that. And I think I'm that for you. You know, we share all of our things. We say we share one brain many times, and just to have that kindred spirit is a beautiful thing. But we need to be safe within everybody within that environment. And then you gravitate towards the people where iron sharpens iron. Right? But, you know, you've got to have a baseline of security. Like you said, people have said that we make them feel safe just so they can breathe for a minute and say, it's okay if I don't know everything.
Right.
Because they already know inside. They don't know everything. You know, that's scary.
But it also gives them the ability to hear and to learn.
We need educator safety. We really do. And then that hopefully will translate into student safety.
Right.
Because, you know, there's been a reputation across the years to, you know, you've got the battle axe nurse educator that's trying to rain down on everybody's parade, you know, and not saying that battle axe probably isn't a great one, but you don't create great nurses by being a tyrant.
Exactly. Like someone shared with us about a program that was, you know, they required their students to wear white shoes.
Oh, yes.
And they were actually making the students color in if it had like a small heart on it.
Or stitching. That wasn't white.
Making them color in that white on the shoe. And I mean,
and they lined them up.
Yeah.
And then
they didn't like they were in the military, you know, like and I'm
they
thinking,
said it was uniform inspection. And this is just
today.
It's not like 50 years ago when nurses came in with their starch uniforms and white caps. This is today. And that's what's being focused on. How does a student feel like that? First of all, you're looking at my appearance when really what we need is for you to be safely attired, you know, within whatever your dress code is, and clean. That's what we need.
You know, but do we need to take the time to have a student color in a little bitty heart on their shoe? Does that really impact the nurse that they are?
No.
What it does is make the nursing faculty have exponentially more work to do.
Correct.
Let's make a learning contract because their shoe had a
Shoes.
pink heart on it. Really? You know, and how does that equate to clinical judgment or to resilience or to these key components that are integral to creating a practice-ready nurse?
We said resilience. What has that? What lives within you that makes you want to come back tomorrow? If somebody's looking at my shoes with anything other than compliments,
She likes her shoes.
I like shoes. If they look at my shoes with anything other than, oh, I love your shoes, what makes me want to come back tomorrow? That's what you're looking at. That's really difficult.
Doesn't have anything to do with the way that I think,
And I'm not
the way that I
building
perform.
those students' resilience.
Mhm.
I'm intimidating them now. I'm judging them, or at least that's what they feel,
And there
even
we
if that's
go.
not the intent.
And there we go into that culture of
Yes.
that culture of intimidation.
Yeah.
There's already a power dichotomy between students and faculty. It's there. It
Sure.
exists already. And so creating things like that
We just build
just
that.
builds that dichotomy
Yeah.
even greater, and it doesn't need to be there.
Yeah.
I feel like my students respect me because of the role that I have and the relationship that I have with them.
I hope I pass on to them that I don't have all the answers, but I will help you find them, because no nurse has all the answers. No educator has all the answers. And they need to know where to look, and I will help them find where to look. And that hopefully will help bring them alongside of us instead of pulling them. You know, we're out in front pulling them behind, or we're behind them pushing them out. We've got to be alongside them.
Exactly.
That builds resilience because you've got somebody to support you.
Yeah.
You've got someone behind you, you're falling back on, or you're getting drugged forward. But if they're beside you, they're
Yeah.
holding you up.
Yeah. Absolutely.
That was genius,
is
wasn't it?
The only way that we get to the root of it is to talk about it
Mhm.
and to have real discussions
Right.
on these are the things that are really happening, and how do we as leaders in the profession, and I'm not talking about Cherie and I'm talking about all
y'all.
all y'all, because okay, there's y'all, which is
Singular.
singular,
Or
and
two.
then there's all y'all, which is everybody.
And all y'all
and all
are
y'all
leaders in the profession.
are leaders in the profession, and it takes all of us to make a change that can impact everyone.
Yeah.
And this is a change that has to happen.
Yeah, we
you know?
need this kind of
We need
ripple
it.
effect. You know, to me, this kind of talk is just as important as people wanting to know, how do I best teach fluid and electrolytes?
Oh yeah.
How do I best teach acid base? These are, you know, harder kind of concepts to
Right.
get across to students sometimes. But those are the questions that they probably want to ask too, like, how do I be a better educator?
Right.
How do I foster resilience and professionalism and emotional intelligence along with clinical judgment into these students? How do I infuse those things? Just as critical.
It's funny sometimes too, we'll work with faculty groups, and you know, somebody will speak up and they'll say, you know, we don't have any issues with incivility here. And then you look around the room and I'm thinking,
We already know.
If you don't think you got any issues, you might want to.
Be you.
It
You might be the
you.
one.
It might be you.
Yeah.
But I think it's a great opportunity.
Me
You know,
too.
just
Yeah.
to have to talk and to be real with each other.
Absolutely. Spill the tea.
Have you,
Yes.
have you all heard this?
Heard the tea?
This is some bull.
Yeah.
Like, you know,
That
we're
it
gonna
is.
get that we're gonna get a rock. Like, don't give me a rock.
Hello and welcome.
Hello and welcome. What else do you want?
That's the sound.
Oh,
I'll play the sound like.
oh, I got it.
Oh, okay.
I
You thought
the
you were
air
getting
was
an
stopped.
X.